Treatment of hypertensive crisis. Severe hypertension is a medical emergency that can lead to a stroke and sudden death. Immediate parenteral administration of antihypertensive drugs can avoid severe complication and irreversible damage. Diazoxide and nitroprusides are the potent vasodilators used in hypertensive crisis. Now comes to coronary artery disease. Due to the arterio and atherosclerosis of the coronary artery disease, fatty plaques cause blockage and decrease the blood flow of the myocardium. Okay, fatty plaques and flakes causes the blockage and decreased blood flow to the myocardium. So main symptoms is angina pectoris or chest pain caused by lack of blood and oxygen supply. So there is a particular demand the oxygen supply and the blood and oxygen supply to the heart. But if the blockage and decreased blood flow is occurred to the myocardium, then the heart cannot able to supply the able to maintain the supply of blood and oxygen to the heart, to the body. That's why the chest pain and the symptoms of angina pectoris may occur. Myocardial infarction occurs when an artery is totally blocked. So this is myocardial infarction caused by complete blockage of one of the coronary arteries. Heart cells deprived of blood or oxygen become ischemic and die and form an infarct. Myocardial infarction may result in sudden death, or the infarct undergoes a healing process and is replaced with connective tissues. After a myocardial infarction, the heart may be weakened and develop congestive failure or cardiac arrhythmias. So this is an image of normal and abnormal heart rate. What would be the normal heartbeat? The image when the heart is beating fast, and what the image when heart is beating slow. And this is the last one is the image of irregular heartbeat. That heart is beating not properly. Cardiac arrhythmias are disturbances in normal electrical activity of conduction system. The electrical disturbances interferes with the ability of heart to pump blood and may cause angina pectoris or congestive heart failure. Okay, severe arrhythmias can cause ventricular fibrillation and sudden death. Arrhythmias are disturbances in normal electrical activity of heart. Arrhythmias can be detected on a recording of electrocardiogram. That means it is called ECG. Supraventricular arrhythmias occurs above the ventricles in the atria, SA node and AV node. Ventricular arrhythmias occur in the ventricles and Purkinje fibers and are usually more serious and life-threatening. Excitability. This is a electrophysiological properties of heart, which included the excitability, refractory period, automaticity. So excitability is what associated with membrane depolarization and influx of sodium ions. What is refractory period? It's associated with repolarization and efflux of potassium ion. Then automaticity, which is ability of SA node and AV nodes to initiate membrane depolarizations. So under these conditions of hypoxia and excessive sympathetic stimulation, the ventricles can also demonstrate the automaticity to causes ectopic beats or PVC. This is also a picture of normal heart rhythm and irregular heart rhythm. This is a diagram of ECG. Here it is a diagram of normal ECG, and this is a diagram of ischemic ECG. Now comes to classification of arrhythmic drugs, which concludes class 1, class 2, class 3 and class 4, where class 1 means class 1 drugs blocks the sodium channels, class 2 drugs are actually beta adrenoreceptor antagonist, class 3 is prolonged action potential and prolonged refractory period, and class 4 is calcium channel blockers or calcium channel agonist. So sodium channel blockers are one class 1A, which quinidine procanamide, 1B lignocaine. Don't it doesn't the lidocaine, which was in your local anesthetics. Don't combine these two names, lignocaine and lidocaine. So 1B is lignocaine, 1C flecainide, and class 2, which is beta adrenoreceptor antagonist. These are atenolol, sotalol, propanolol. Now class 3, which prolong the action potential and action potential and prolong refractory period, like amiodarone, sotalol. And class 4 are calcium channel antagonists, which I told you in case of antihypertensive drugs. They are dihydropyridine and non-dihydropyridine types. Non-dihydropyridines are benzodiazepines and phenylalkylamine. Phenylalkylamine types. Under phenylalkylamine, verapamil are there, and under benzodiazepines, diltiazem is there, and under dihydropyridine, sulfadipine, felodipine, amlodipine is there. So these are the drugs which used in case of which phases of action potential, like class 2, which used in phase 4, class 1, which is used in case of phase 1, class 3, which acts on class 1 and which acts on phase 0 and phase 3 also, and class 4, the calcium channel blockers, which acts on phase 1, phase 2. Here, the drugs affecting the cardiac action potential: sodium channel blockers, which acts in phase 0, like class 1A quinidine and procanamide. 1B are weak lidocaine, lignocaine. It will be lignocaine and phenytoin. Class C, flecainide and profenanon. Then class 2, which is beta channel blockers, which acts in phase 4, propanolol, metoprolol. Then class 3, these are the potassium channel blockers like amiodarone and sotalol, which actually acts on phase 3, and class 4, which acts on phase 2, verapamil, diltiazem. Now comes to angina pectoris.